Good afternoon, everyone. Welcome to this collective conversation. My name is Katarina Storing. I'm coming from the University of Oslo, and I co-direct the Collective for Political Determinants of Health. Collective Conversations is a series of events that we organize that feature talks by our members. This is the last event in the seminar series for this semester, but we're going to be back next semester with new events. So if you wish to stay up to date, you can sign up to our newsletter by clicking the link in the chat. So today we are delighted to have David McCoy with us to give a talk called Holding Powerful Private Actors Accountable in Global Health. And we will be discussing what does accountability actually mean in global health, and do current accountability measures extend to private actors. For those of you who don't know David McCoy is a public health specialist and professor of global public health who works across the fields of health systems, policy and development, global health governance, and the political and economic determinants of health. And he is currently based at the United Nations University's International Institute for Global Health in Malaysia. Previously, he's been professor of global public health and director of the Center for Global Health at Queen Mary University of Oslo, and has also been strongly involved in multiple civil society movements. He has led the UK-based global health charity MedAct for 5 years, and also been an active member of the People's Health Movement, through which he conceived and co-managed the publication of the first 2 Global Health Watch publications. So in today's seminar, David is going to reflect on the experience thus far of UN University's Institute of Global Health's new program of work on power and accountability of private actors in global health. And the talk is going to focus on the challenges of strengthening accountability systems and mechanisms in relation to current global health structures and power dynamics. And I think I'm going to hand over very soon, but just wanted to mention that the UN University is an independent global health think tank within the UN system with a mandate to advance the perspectives and needs of states and populations in the global south. And so therefore has this very unique opportunity to take up the challenge of catalyzing equitable shifts in power and address key accountability deficits that prevent the equitable and effective functioning of the global health systems. So I'm now going to invite David to give his presentation, and audience members are going to be invited to join us in a discussion quite soon, in about 20 minutes. And you can ask questions as we go along by using the Q&A function, or you can also click the raise hand function if you want to ask your questions directly to David, and then you will be elevated to speaker, although without video, from what I understand. So without further ado, I'm going to hand over to David, and thank you very much for joining us. Please, David.
Thanks, Katerini. Is my screen showing? Is it coming through?
Yes, to me it is.
It is. Okay, good. Yeah, well, firstly, thanks again, Katerini, for the introduction, and also thanks for organizing this, and thanks to everyone who's attended. I'm going to speak to this issue of holding powerful private actors accountable across the system of global health governance. And specifically, I want to talk about the program of work that we're developing here at UNU-IIGH. As Katerini mentioned, we have this fairly unique space within the global health system, being an official part of the UN system, and yet we've been set up to act as an independent academic think tank within that UN system. So we're not governed by member state governments, rather we're governed by an independent academic council. And we are also funded to a large degree by an endowment, a 50-year endowment provided by the Malaysian government, which provides us with core funding and which therefore provides us again with a degree of independence in terms of the kind of research and work that we do. And so selecting this topic of private actors and their influence on global health and their accountability is something that an independent think tank like IIGH should be doing. So I very much want to talk about what we're trying to do with our unique position in terms of addressing this issue. I want to begin by firstly talking about global health governance, because what we are doing is looking at powerful private actors as they impact on global health governance. So we're not looking at the accountability of private actors at the level of national health systems, but it's rather focused at this global level and at the global level of governance. And this is a paper that we published a few months ago, which was really a foundational paper for our program of work, which sets out, if you like, the parameters of this program of work that we're developing and hoping to be able to implement over the next 4 or 5 years. So maybe the first thing to talk about is the way in which we have chosen to define global health governance. So this coming directly out of this working paper, and I'm glad to see that I've got some of my co-authors in this call. We define global health governance as the formal and informal structure, systems, and institutions through which actors make decisions about global health standards, policies, and priorities, finance, organize, and implement global health initiatives, programs, and plans. And then thirdly, influence and engage with actors, systems, or institutions that lie outside the health sector, but which impact on health. So we've got a fairly broad definition of global health governance, and we are looking at global health governance as a set of functions that extends beyond the health sector to other sectors that impact on health. In the paper that we published, we also describe and talk about the fact that global health governance, the system of global health governance, is located within a wider system of global governance, and that both this system of global governance and global health governance is influenced and impacted on by national governments and national politics, as well as by international politics. And both the system of global governance and global health governance have, of course, been shaped and influenced by political and economic factors, and certainly over the last 3 or 4 decades by the dominance of neoliberal ideas, policies, and institutions. So we describe all of this in our foundational working paper as the context in which we are trying to then develop a program of work on powerful private actors and their accountability. The other thing that we do in this working paper is to attempt not just to talk about or define global health governance, but to be explicit about what we consider to be good global health governance. And this, of course, is a normative matter. And we set out our definition of good global health governance in 2 parts. Firstly, it's about the what that we want global health governance to achieve. And here we talk about improving global health in ways that are efficient, effective, and equitable, and with a strong focus on reducing social health inequalities, both within and between countries and also across countries globally. And then we also define it in terms of the how we want governance to be conducted. And here we talk about good global health governance as being conducted through processes and practices that are procedurally fair, inclusive, and consistent with democratic values. So that's us trying to set out our definition of good global health governance. And we go on to say, well, what does this actually mean? How would good health governance at the national level manifest? So we really wanted to kind of describe what it would look like at the global level, of course. But in order to do that, we started by thinking about what good governance looks like at the national level. And again, in this working paper, we define that. We describe good governance as firstly involving government, and governments that are expressive of democratic values. So we talk about democracy in our definition of good global health governance. And we also talk about democratic values as including but going beyond representative or electoral democracy, and the separation of powers and checks and balances across different branches of government and organs of the state. So that's part of the definition. But we also describe it in terms of there being a wider acceptance across society of norms, customs, and ideas that value fairness, probity, honesty, and social responsibility, and the idea of universal human rights. And then finally, we emphasize good and democratic governance, requiring a healthy civil society and a variety of enablers of democracy, including, for example, public interest journalism and media, institutions of higher education that champion academic freedom and encourage informed public debate. And again, coming back to this idea of a healthy civil society, civic organizations with a mandate to represent the views and interests of marginalized groups in society. So if that's what good governance at the national level would look like, I guess the next obvious discussion point would be how would this be translated at the global level, where there isn't a global polity, there is no world state or world government. And we spend a bit of time describing and discussing how these features of a healthy democracy, of good governance at the national level, might be translated at the global level of governance. We describe, of course, that although there is no world state or world government, we do have global governance operating through the UN and the wider multilateral system. And we also describe the way in which institutions and structures of global governance have evolved, and that there are also new structures and systems of power that operate at the global level, including the emergence of multi-stakeholder forums, public-private partnerships. There are also governance systems and structures that are entirely private in nature, such as the way in which credit ratings agencies operate. And then, of course, the really important way in which governance is enacted globally or multilaterally through trade and investment agreements. So all of this is background, if you like, to us thinking about how we should establish a program of work around holding powerful private actors accountable. Now, although the program of work started off being focused on global health governance more generally, we have decided to hone in on powerful private actors for a couple of explicit reasons. Probably the most important reason is because this is a neglected area in the kind of academic literature about global health governance. So there is much more talk about how you hold institutions like WHO accountable, how you hold global health partnerships like the Global Fund accountable. There is, obviously, with the growing interest in the commercial determinants of health, discussion about holding corporate actors accountable. But we have also wanted to focus our attention on two other types of powerful private actors, in addition to transnational corporations. The second is powerful private financial institutions and their role in the financialization of health and healthcare. And then the third is around the accountability, power, and influence of private foundations, including the Gates Foundation, but not limited to the Gates Foundation. So we've tried to set out our program of work to be focused on these three sets of powerful private actors. And this also emerged from an expert group meeting that we held in Oxford last year, where we unpacked these three sets of powerful private actors and attempted to also provide a rationale for why it was worth UNU-IIGH developing a program of work on this set of issues. Our working paper has also tried to unpack the concept of accountability. In the working paper, we talk about accountability being a component of good governance. And we also talk about accountability as something that is intimately related to power structures and dynamics. We are quite explicit about the fact that many accountability systems that do exist tend to reinforce or reflect existing power dynamics and power structures. And what we are trying to do is to look at the accountability deficits with respect to powerful actors and those who those powerful actors have an impact on. So we are placing an emphasis on social accountability and on public accountability of the powerful actors, talking about those actors, for example, with the power to govern, being accountable to those who are affected by systems of governance. So we're really talking about downward accountability and to some extent horizontal lines of accountability. Although we are focused on the accountability of powerful private actors, because of the fact that many powerful actors seek to evade or minimize their accountability to others, we are also explicit about the fact that governments play a really crucial role. Governments and intergovernmental organizations play a crucial role in establishing and managing the rules of governance and in ensuring that there is a degree of mandatory accountability when it comes to holding powerful actors accountable. So we're looking at powerful private actors, but we're also focusing on the role and responsibility of governments in ensuring that these actors are adequately held accountable. We also describe and unpack what we mean by accountability in terms of it consisting of 5 elements. These are standards against which actors may be held accountable, the availability of data and information that can be used to assess the decisions and actions and impacts of actors and institutions, so that we can also measure them against the standards that we've established. Mechanisms of answerability, so that there are requirements for actors to respond to questions or requests for information or explanations about their decisions, actions, and impact. The 4th element is sanctions, or the threat of sanctions, which would be applied when an actor or an institution fails to meet expected standards of behavior or performance. And then finally, mechanisms of remedy or restitution or rehabilitation, or compensation and corrective actions to prevent any future replication or repetition of a breach of expected standards of behavior and conduct. So this is quite an extensive definition of accountability. And I think when we're looking at accountability systems and mechanisms as they exist now, what we want to do is to be able to look at them across all 5 of these elements here. So in terms of our program of work, just a little bit about what we're trying to do as a think tank within the UN system. This is a 5-year program of work. We're in the first year of that 5-year period. And part of what we're trying to do in this first year is really about making the case, providing the argument, the rationale, kind of collating some of the evidence as to why it is important to look at the power of certain powerful private actors and to hone in on the accountability deficits associated with them. The other thing that we're trying to do is to, I suppose, desensitize this issue, or to make it, or to normalize a conversation about this issue. This is obviously quite a sensitive topic, and that there are many people working in global health that would prefer not to be talking so explicitly about the unaccountable power of private actors. But in making the case, what we're also trying to do is to encourage more people to raise questions about this issue and to start looking at it, and to start problematizing it. in terms of its impact on health. We're also trying to build greater interest and knowledge about the way that current and existing systems of accountability work or do not work. And again, also trying to build interest and knowledge about the scale and extent of power that some of these private actors have, and the way in which that power is deployed to not just impact on health, but also to impact on the way in which the system of global health governance operates. The fourth thing that we're trying to do, certainly in the first 2 years of this program of work, is about building alliances and partnerships, both with civil society organizations, but also with other parts of the UN system and with researchers and academics who have an interest in this and who have a concern about wanting to strengthen democratic and legitimate global health governance. And we're hoping that with this, we will then be able to find ways to catalyze action to do two things. One is, firstly, to be able to correct some of the accountability deficits that exist. And then secondly, to use accountability as a mechanism by which we can also redistribute power or rebalance some of the power symmetries that exist across the system of global health. When I say catalyzing action, I mean working with and through other actors across the UN system, and again, working through the alliances and partnerships that we hope to build over the next few months and years. I'm going to finish very, very soon, but a couple of examples of some of the research and analysis that we're currently doing. One of the things we're doing now is to look at some of the existing systems holding corporations accountable. We've been reviewing and analyzing the Access to Medicines Index and the Access to Nutrition Index. These are two mechanisms that are currently hailed and celebrated as effective mechanisms of accountability for pharmaceutical corporations and food companies. And this is a report that we recently published describing the weaknesses and limitations of this mechanism of holding multinational corporations in the pharmaceutical sector accountable. And we're about to publish something similar for the Access to Nutrition Index. And perhaps I can talk a bit more about this in the discussion section. We have recently established an independent expert group to look at the weaknesses of the Access to Nutrition and Access to Medicines Index. And in order to get this group to examine our analysis of these two indices, hopefully to reaffirm our conclusions that these indices are weak, ineffective, and may also constitute a form of corporate accountability that actually reinforces existing corporate power in ways that are harmful. So what appears to be a mechanism to shift corporates towards improving access to medicines and healthy food could in fact be a mechanism that hinders progress. We're also trying to, through this independent expert group, look at aspects of corporate behavior that should be monitored, which aren't monitored, and to also call for more meaningful corporate accountability institutions, initiatives, and instruments that currently exist. We're also busy with a series of working and briefing papers on a variety of topics, one on financial actors and institutions and the whole process of financialization and its impact on global health, wanting to look at the influence of private individuals and foundations on global health. We have a paper on powerful private actors looked at through the lens of sub-Saharan Africa, a briefing paper on tax as an instrument to redistribute power and wealth, but also to regulate powerful private actors more effectively, and another paper looking at the role of private consultancy and accountancy firms in global health. And here we're talking about the big three consultancy firms, which includes McKinsey, and then the big four accountancy firms such as KPMG. And then the last thing I want to talk about is that we are trying to use our role and mandate within the UN system to convene conversations and discussions about all of these issues, and also to provide a platform so that we can help to amplify the work, the research, the analysis and advocacy of other actors in the global health system, and in particular, civil society organizations. At this stage, we haven't yet engaged with governments or policymakers, but that is something that we hope and expect to do in year 3, 4, and 5. What we're trying to do is really build the foundations for this program of work before we start engaging with active policy advocacy and policy impact.